Good morning, all. This mask out of the way. I want to start this morning with just talking about some good news before we get to less good news. Vaccinations. The great news today is that our doses for the first dose, the population 16 and above, have now reached almost 50%. So that's a very positive step forward. And for those who are fully vaccinated, we're up to about almost 22%. And we're going up at about 5% a week. So can I just say to everybody out there, we're not going to beat this virus unless you all get on the journey with us. And we need you all to book in for vaccinations. You can do it through your GP, you can do it through your pharmacist, you can come to one of the state hubs. We need you to do that because that's our freedom path. Vaccination is our freedom path. Tomorrow, Sunday, at Sydney Olympic Park, there will be a special day, effectively a big day out for the food providers of Sydney. If you're involved in any aspect of that, if you're selling food, if you're to checkout counters in a shop that is providing Sydney with food, you can make a booking to go tomorrow to Sydney Olympic Park to get vaccinated. We've already got 1,000 people booked in, but there's another 4,000 vacancies. So jump on the Service New South Wales, or actually jump on nsw.gov.au. That'd make it easy. nsw.gov.au this afternoon. They're just putting that connection up there for you. So sometime this afternoon, maybe after about 2 or 3, hop on that web address and you'll be able to make a booking. Also, I want to emphasise this week, of course, is the big week for HSC students at Kudos Stadium. All the parents and students would have received the link sent out yesterday. Don't waste time. This is your big chance. This is your chance for gold, as I said yesterday, to go and get vaccinated. There's Pfizer vaccine available there. Good vaccine, good opportunities. AstraZeneca's available, Pfizer's available in our various venues. Plenty of vaccine. So go and get vaccinated. But for the young people, this is a really big opportunity to get it. It's dedicated to you for the week. So respond to the link. There was a link in the letter that came out to you. So make sure you or your mum and dad get onto the link and make the booking. It's essential you have a booking because we don't want everybody arriving at the one time. We want you all to have a really good experience, similar to what occurs in our other hubs. So make the booking and get yourselves out there. Try and arrive not too early, not too late. I think the letter that went out to you all said arrive about half an hour. I would stress get there half an hour, but no earlier because that will just increase the queues. But don't get there any later either, or you might miss your booking. I also just want to stress that where we go in this situation is in the hands of the community. The government and our health staff and the police and the ADF can only do so much. In the end, this is in the hands of every one of us as community members as to when and how we get out of this rather troubled time with COVID. So I just want to stress that and suggest to everybody that they do need to get on the journey in terms of the vaccinations, but also to recognise that there are some sites that we know are continuing to be problems. We know there are essential workers going out, and of course they have to work to keep us all with our particularly our food and so on, our essential items. But what we're seeing continually, and a lot in southwest Sydney and western Sydney, and I'll have Dr McAnulty say a bit about Canterbury Bankstown in a little while, we're seeing people go to work and forget the COVID rules that are there. So, as Dr Chant has said on a number of occasions, one of the regular ones is everybody behaves well out in the shop, but then they go back to have a cup of tea out the back and they're all close together, and before we know it we have, as we did with KFC, I think it was yesterday, more than a dozen cases. So we really need to remind all of the smaller businesses to do the right thing and follow the COVID safe plan. The reason you're allowed to operate is you have a COVID safe plan, but you've actually got to comply with the COVID safe plan. And if you don't do that, then we will continue to have these escalating numbers of cases, particularly in southwest and western Sydney. I also just want to say that on that theme of people having it in their own hands, I think it's time that people woke up to the fact that we're not just asking people to not go and visit other households. You're not expected to go to a party. You're not expected to go to a gathering. That is absolutely not what you're supposed to be doing. And of course, we've seen the cases up in Newcastle that it appears there might be connections with what's now happening in Armidale, and I'll address that in a moment. We need to make sure that we stay at home. It's a pretty simple rule. Stay at home. Don't go out. Unless you need to go out once a day to get your shopping, don't go out. Stay at home. And that is the biggest thing you can do for all of us and for yourself to make sure that we beat this Delta virus that is wreaking havoc across the world. If you don't want it to wreak havoc in our community, then just stay at home. It's a pretty simple message. Now, the tests. We had 108,449 tests to 8 p.m. last night. I want to thank the community. I mean, the community coming out for those tests is essential for our health team to be able to know what's going on with this virus. So thank you. I remember when we were talking about hoping we'd get up to 40,000. So the Sydney community, the New South Wales community, is doing a great job on that front. But the not so good news, to 8 p.m. last night, we had 319 locally acquired cases. 319. We had 2 international travellers. Of that 319 locally acquired cases, 125 have been identified already as linked to previous cases. 108 are contacts of households, so they're already, we know we can work through those connections. 17 are close contacts of previously known cases, but 194 are still under investigation. And obviously that presents challenges for our health staff. That's why I'm saying to the community, you've really got to get serious about staying at home. You can't leave our health staff continually to be having to search where you've been, what you've been doing. It's not fair to the community, it's not fair to yourself, it's not fair to anybody. I'll leave it to Dr. McAnulty, if that's all right, to let us know about how many people are in hospital, how many people are in intensive care. I do want to stress again the location of today's main cases are in southwest Sydney. In that local health district there's 112, and in Western Sydney at local health district there was 98. I want to emphasise that this disease, because people go and visit other households when they shouldn't, and for a variety of other reasons, but that seems to be the essential reason, and for the workplace issues that I've already discussed, we constantly see the potential for cases to creep out of those 8 LGAs. And what we are seeing now is moving into that area just west of the Blacktown area and into the Nepean area, we're seeing new cases. So at 8 p.m. last night, we saw 23 new cases just in that area. And from the advice I've had this morning, we expect there'll be more tomorrow. So I would just say to the residents in that area, you need to go and get tested. If you have any symptoms at all, be on high alert. We really want to stop the transmission in that area before it goes further. I want to stress to the families, particularly who are, I believe, probably still visiting each other, going from one household to another, you can't do it. You might think you're outside the LGA boundary, or maybe you're not thinking about it at all, but you cannot go and visit other households. And I particularly want to just put people on notice as to where the cases are, the 23 from last night. The cases were in Colleton, Erskine Park, Kingswood, St Clair, St Mary's, North St Mary's, Ropes Crossing, Penrith, and of course my advice to the community in that general area, as with the broader Sydney area, indeed across New South Wales, if you have any symptoms at all, go and get tested. I also just have to advise, unfortunately, that there are, at this stage, 2 cases in the Armidale area. Those came in again, concerningly, late last night, and the Armidale Regional LGA, or local government area, which includes the major city of Armidale, that's about 25,000 people. Guyra is about 3,500 to 4,000 people. And of course there are some smaller towns. on the advice of our public health unit and Dr. Chant's team, that city, that area, that LGA, Armidale LGA, will have to be put into a lockdown, and that will occur from 5 p.m. today. It'll proceed for 1 week to allow the health team to get a handle on what other cases might have been transmitted as a result of a particular young person going into that area and apparently transmitting it to somebody else. Our health team is going to be working on that. I'm sorry to the people of the Armidale local regional council area, but I would say to you this is being made as a caring concern, out of caring concern for your area. Whilst it's going to kick in at 5 o'clock this afternoon, I'd also say to you, if I were living in that area, I would be actually not going out of my house today. I would be staying at home. I wouldn't be visiting friends, and I'd be making sure that I protect myself and my family. Of course, it will be the same arrangements as applies in the Newcastle area, which is effectively the Greater Sydney lockdown area. And on that note, I think I've covered. Oh, I might leave it to Dr. McIntyre to cover the unfortunateness. There have been some more deaths, sadly, and I think Dr. McIntyre can talk about those. But I just want to say to each of the families, I can't imagine how you're feeling, but my condolences and the government's condolences to each and every one of you on the passing of your family members who've been caught up in this terrible COVID situation. Dr. McIntyre.
Thank you, Minister, and good morning. There were 319 locally acquired COVID cases reported in New South Wales until 8 o'clock last night, and there were 2 overseas acquired cases. This brings 4,929 locally acquired cases reported since the beginning of this outbreak on the 16th of June 2021. As the Minister said, there were 108,449 tests reported yesterday compared to 109,547 the day before. In terms of hospitalisation, we're seeing lots of cases in hospital. There are now 345 people with COVID in hospital, including 56 in intensive care, of whom 23 are ventilated. Of the 56 cases in intensive care, 4 are in their 20s, 4 are in their 30s, 3 are in their 40s, 19 in their 50s, 8 in their 60s, 14 in their 70s, and 4 in their 80s. So this disease is affecting seriously people of all ages. Of the 56 people in ICU, 51 are not vaccinated at all. 4 have received the first dose of AstraZeneca vaccine, and 1 has received the first dose of Pfizer vaccine. Sadly, there have been 5 deaths since yesterday of people with COVID. A woman in her 80s, a man in his 80s, and a man in his 90s, all from southwest Sydney, died at Liverpool Hospital. These 3 deaths bring to 5 the number of deaths now linked to the Liverpool Hospital outbreak. We've also been notified of a death of a man in his 60s from southwest Sydney at Liverpool Hospital and a man in his 80s from the inner west who died at Royal Prince Alfred. These infections were acquired in the community. None of these 5 people who died were vaccinated, and we extend our sincere sympathies to their loved ones. There have now been 27 COVID-related deaths during the current outbreak and 84 since the beginning of the pandemic. We're concerned about cases in Newcastle. 4 new cases of COVID-19 have been confirmed in young people in Newcastle, and 2 new cases have been confirmed in Armidale, a woman who recently travelled to Newcastle and one of her household contacts. These 6 new cases bring the total number of cases in the Hunter, New England area to 13 since Thursday the 5th of August. There have been 2 confirmed COVID cases who attended the John Hunter Hospital Emergency Department. Anyone who was at the emergency department between 8:40 p.m. on the 5th of August and 1:50 a.m. on the 6th of August is a close contact and must get tested and isolate for 14 days sincere, regardless of the symptoms or outcome of the test. And the hospital is following up with anyone who's at the department at the time. We've seen sewage detections in Dubbo, and we don't have any known cases in Dubbo, so we're urging the community in Dubbo to come forward for testing with even the mildest of symptoms. Take it very seriously. If there's a case there, we need to find them to make sure the community is safe. We're very concerned about Canterbury Bankstown. This now is the #1 LGA for cases, with 92 cases from yesterday from the Canterbury Bankstown location, LGA. In fact, we've had 489 cases in the last week, so it's our most prominent LGA. So people in the Canterbury Bankstown LGA, please take extreme caution, follow the stay-at-home rules, follow all the rules for authorised workers, keep each other safe. Thank you very much.
Thank you, Dr. Minister. Good morning. 335 penalty infringement notices issued in the last 24 hours right across New South Wales, including up in Northern region, around the Newcastle and Upper Hunter area, where police were very active over the last 24 hours, making sure that people complied with those public health orders that exist up there now. An example that I think is really quite relevant is last night around 8:30 p.m, police in Sydney spoke to 4 people that had gathered around Mrs Macquarie's chair. They were not from the same household. They had decided to gather there to purchase some food and sit down and have some sort of picnic and a gathering at that location, clearly outside the public health orders. The Minister has made it very clear that stay at home means stay at home. There are provisions there to go out for exercise, for recreation, and there's certain boundaries around that, and of course to purchase food. But what we're seeing is that people use that reasonable excuse to go out and purchase food, takeaway food, a coffee, to then go on and congregate and gather for an extended period of time, which is clearly not what we want people to do. And in fact, what we've seen in and around Canterbury Bankstown and the Campsie area is that people are going out to get food, whether that's a butcher shop, whether that's fruit and vegetables, or whether that is going to a supermarket or another smaller store, and then they are using that to then gather and congregate. And clearly that is an area of risk that we really want people to appreciate, that that's where the virus will spread. That's where you will contract the virus and you will take it home to your household and to your family. Commissioner Fuller has made it very clear last night that we'll double down our efforts in and around that area of Canterbury Bankstown and Campsie area, in particular in the central business area, where people unfortunately do not seem to be taking notice of the warnings that are given, and police will be very strong in terms of their approach to people that contravene the public health orders, particularly over this next 48 hours. The Minister today has announced some restrictions up in the Armidale and Guyra area. I want people to feel supported that there's an emergency operations centre that will open there, that it will involve local government, local agencies. It will involve supporting the communities of those 2 large cities and the towns and villages around it to get through the next 7 days and make sure that no one feels unsupported and no one is left behind. Thank you.
Last night, the Chief Medical Officer, Professor Paul Kelly, said that it's time for New South Wales to have a circuit breaker and go harder. You've just said yourself, you're telling people again, please stay at home, don't leave your home. Is it now time to rethink the current New South Wales strategy?
Look, we have the toughest lockdown in the country at the present time. What is not happening is that people are not actually complying, and the rules can be the rules, but if people don't comply, then obviously the community will continue to suffer. I did see Paul Kelly's comments. He hasn't told us what that circuit breaker would be. I just heard what you thought it was, but I haven't heard that. And I checked with my own Chief Health Officer this morning, and she hasn't heard that either. But I think what it does is just expresses the concerns that we all have, that the circuit breaker in New South Wales and in Sydney is for people to comply with the rules. Pretty simple. Just stay at home. That's the circuit breaker. And I think the PM's said that many times as well, as has the Premier. The key here is to stay at home and get vaccinated. Pretty simple formula for pretty well everybody. Stay at home, don't go out unless you have to, don't go and visit another household, and get vaccinated. And the vaccinations are picking up, but we want to see a lot more in the way of vaccinations. I think if we continue the way we're continuing, well, that's positive. But I'd like to see people really getting along to their GPs. The federal government is now, obviously, GPs and pharmacies are in the domain of the federal government in terms of, well, certainly the GPs are definitely, and to a degree the pharmacists are. And they've actually broadened out the vaccination opportunities. So there's really no excuse to not go and get vaccinated. I remain surprised that even in my local area, when I wander around and people stop me and talk to me, that they're telling me they're not vaccinated. Well, go and get vaccinated. That's the name of the game. Sorry, I'll come back to you. Who was that then?
Oh, sorry. Minister, a plan to bus Year 12 students...
Come to you next, sorry.
A plan to bus Year 12 students at Kudos Hub has been scrapped.
Sorry?
A plan to bus Year 12 students?
Oh, bus,
yes, that's okay. From regions of Western Sydney into that Kudos Hub has been scrapped. Was that due to concerns about transmission on the buses? And we've heard from principals say that they're concerned their students now just won't go because access is too hard. What's being done to help that?
Well, look, education did their bit. They tried hard to work with health on the buses, but there was, let's just say, the staff apparently were not that keen to be supervising the education staff. So in the end, it was decided. A lot of the kids, a lot of young people have their own licences anyway, or their mums and dads had indicated they were more than happy to take them. So it's just a reasonable way to do it, as long as we get the young people along. And again, thank you for the opportunity to say again, the link has been sent to all 24,000 young people. This is your opportunity to get a little bit of gold, get a vaccine in your arm and keep safe. And know then that you can definitely do your HSC in the next, I think it's October. So you will be very, very safe to go and do your exams and keep all the other young people safe when they're doing theirs. Sorry, you wanted to ask me a question?
Yeah, Brad, do you know how many cases have been linked to the rally a couple of weeks ago?
There's no clarity on that at this stage because obviously the difficulty is, I wish it was easy, but people who've come in to be tested don't necessarily tell us they're at the rally. So, as you'd expect, because the police would take more than a passing interest in that. I must say it continues to be a disappointment, and I suppose I have my suspicions that we might be seeing some of the increases as a result of that, because there were definitely people there from southwest Sydney. But there's no clarity on that. It's just concerning, obviously.
Minister,
sorry,
reports
yes.
about...
sorry, guys, I'll come back to Lizzie next, sorry.
Reports about vouchers for vaccinations involving councils and ratepayers. How would something like that work?
Look, the government is discussing and working with industry to look at options that would encourage some sections of the community to have the vaccination. But I think certainly the broad evidence from overseas is that you tend to have at least the first 40 or 50% pretty keen, and then it's harder to get the next 40 or 50%. But I would have thought, I mean, Aussies love being free. We love getting out there. And I would have thought the biggest incentive to all of us is just to get our freedom back. Get out and get vaccinated. Yeah. Sorry, Lizzie.
Minister, is it realistic to think that New South Wales has already seen our last ever zero COVID day? And if so, where does that leave us in terms of being on a different page to the other states and a long-term future in terms of borders?
No, look, I still harbour the hope that we'll get back to zero. But Delta's a pretty wild variant of the virus. Let's face it, it's wreaking havoc across the world. And what we need is our community to back each other in. It's almost a level of self-entitlement to think that you don't have to have the vaccine, but your neighbours do. Well, no, you all do. We all do. Every one of us. And if we don't get the vaccine and we don't follow the rules, well, it makes it more difficult to get back to zero, but I'm still hopeful we'll get there.
Minister,
sorry, I'll come back to you. You first, yeah.
In regards to the young man who unfortunately died at home earlier this week from COVID.
The 27-year-old young man.
Yes,
yeah.
And it might be one for Dr McAnulty as well, but his family claims that he was never given the opportunity to go to hospital. Is that the case, and if not, why?
That was raised yesterday in the press conference, and it was addressed yesterday by Dr Chant. So I'd refer you to that in essence, but whilst we've seen those comments, that's not the health advice. and I don't think it's appropriate that any one of us should seek to impinge on their privacy. Obviously, it's a very horrible time for them, and their particular views should be respected, but I won't be making any further comment on that. I just remind you too that it's going to a coronial hearing at some point. So, but again, I express my sympathies to him, to his family, his partner, I think, and the family. It would be an awful time. So, yeah.
Minister, we're talking about people still gathering, and particularly these sorts of household gatherings, and the Deputy Commissioner saying now that people are even using supermarkets to congregate. We're about 6 weeks into this lockdown now. Why is this still happening in parts of Sydney? Why is the message still not getting through? And is it time for increased compliance in those areas?
Look, as the Deputy Commissioner said, people are doing things they shouldn't be doing. And the police are doing their best to ensure compliance. But at the end of the day, there has to be personal responsibility here. People have to actually not think that it's smart to try and find your way around the rules. I mean, it's a bit hard to stop people going and getting food. That'd be the last thing that anybody would consider. If people decide to hang out together in the grocer shop or in the supermarket, well, it's just plain stupid. But it does make it very hard for us for the health team and the government and the broader community to stop the virus. People have to just stick by the rules. The rules are pretty clear. Stay home. Stay home and get vaccinated. Sorry, can I go? Well, can I come back?
Yeah, we can come back to it.
We'll come back to the Deputy Commissioner. I'll put him up. You can have a go in a second. Yeah.
Yeah. 8 LGAs in lockdown, why do you think it is that Canterbury Bankstown...
Sorry, I'm just trying to...
Out of the 8 LGAs under lockdown, why is it Canterbury Bankstown is the one that's the biggest one of concern? What are you noticing there?
What we're seeing is a rapid increase in numbers in that particular area. I think the whole community would remember that we talked a lot about Fairfield. I just want to say to the people of Fairfield, thank you. You've actually done an incredible job, and your numbers have come down dramatically, but don't give up, don't stop, because we need you to keep staying home and keep staying in your own household. But what we're seeing in Canterbury Bankstown is people actually not necessarily complying with that, but also Canterbury Bankstown is a major area for workplaces, smaller workplaces and bigger workplaces. And what we're seeing in the larger workplaces, particularly the distribution centres, the larger distribution centres that operate, and I think in that area we've got Woolworths and Coles and Aldi, Metcash, they are doing a fantastic job. They have really, the work they're doing is incredible. They're making sure their COVID-safe plans are well complied with. They've also taken steps to make sure their staff get vaccinated. Some of the smaller businesses, not so good. And so that's why I said a little earlier, you need to actually have your COVID-safe plan and stick to it, because you don't want your business to be the one that actually gets shut down, but you also don't want to see all of your staff end up positive. And I think it was the KFC. Well, KFC, that general direction. I can't remember whether we've actually named that particular one, but a KFC that ended up with I think currently there's 13 staff. That just shouldn't be happening. If you comply with your COVID-safe plan, everybody wears a mask, they socially distance, they don't hang out in the tea room afterwards, they don't hang out chatting, then people won't get it.
Minister, can I
Sorry,
Newcastle? There's reports up there that the testing lines are very long, more than 3 hours. People are being told they won't get their results back for 4 days, and some people are being turned away. Is there any more capacity for increased testing venues up around Newcastle?
I've asked Health to look at what other capacity we might have. You'd appreciate that when we used to get excited about having 40,000, if we attained 40,000 tests each day, that involves somebody there to take the test. It involves somebody taking the test results, or the test itself, the sample, to a pathology lab. It involves people actually doing the pathology lab and at the pathology lab running the tests. It involves someone then administratively sending the results back to the individuals. It's a very big task, and now that we're up over 100,000, there's no question it's putting pressure on the not only New South Wales pathology, but each of the private laboratories that we've engaged. But I've certainly asked Health to have a look whether there's availability amongst any of the other private labs or laboratories to see whether they can do any more. And can I say thank you to the people of Newcastle. They have been very patient, but it is part of living in a pandemic. I know in my own area during the Northern Beaches outbreak, we had 3 to 5 hour waits as well. So it's just when things are a bit challenged in your area, it is a challenging time, but the time you're putting in up there, I appreciate it. I think our health people appreciate it. I know they do. And we really need you to get tested, so please don't be put off by those queues.
Minister,
I'll stick with Lucy and come back to you. Is that right? Yeah, sorry.
On Armidale, it sounds like someone from Newcastle has travelled to Armidale. Is that how it's got up there, and has that person done anything wrong, or is it just an unfortunate event?
Yes, to your first question is the apparent situation, and quite possibly to the second, but at the moment our focus is not on the punitive side, it's on trying to talk to the individuals about who and where they've been, where the person's been, who they've talked to, who they've spent time with. We've got to make sure that our health tracers get the opportunities to ask those questions first. Yes, sorry.
Right, the construction sector, obviously the vast majority of employees, tradies remain in lockdown in those 8 LGAs. One, has the government considered offering fully vaxxed tradies the chance to work again? And two, have police been getting reports about tradies travelling outside those LGAs searching for work?
I haven't heard of the second one. I think there's general compliance. I'm sure there would be exceptions, but there's been general compliance. And I can say the government are obviously looking at all options there. And we continue to discuss how we might manage. Every minister in the cabinet broadly, I think all the community know how important our tradies are in southwest Sydney to not only small projects but the big projects that provide jobs through major construction. They put food on the table for individuals, and certainly our government has been talking extensively about that. And hopefully we might see some changes, but look, too early at this stage to say.
Minister, another GP clinic in Western Sydney has been found charging for vaccination consultations. Rather than just refunding that money to patients, I mean, should they be fined for doing that?
GPs are regulated by the federal government, not the state government. We manage all the hospitals and community health centres. But I must say it is very, very disappointing to see that any GP who was otherwise there generally to look after us would also dip their finger or dip their hand in somebody else's pocket to get money they shouldn't have had. The Minister Hunt has indicated that the federal government is jumping on every case that they get reported to them and making sure that there's appropriate dealings with those particular GPs. I would say also to GPs who are in that situation, don't forget that that may well be considered to be unprofessional practice, and you may well be referred to the federal body by the federal government. So just be very cautious. But bottom line here is you've got no right. Vaccines are free, your services should be free. The federal government picks up the tab on that, and you shouldn't be getting any extra.
Dr. McAnulty.
Hang on, I'll go to the Deputy Commissioner because you asked first, and then we'll get Jeremy.
Okay, Deputy Commissioner, you just mentioned before that people are now using supermarkets to congregate. The Chief Medical Officer, Professor Paul Kelly, has said that compliance needs to be ramped up in New South Wales. Do you agree? And what more can be done now? We're 6 weeks in and people are still congregating.
Yeah, I guess the last part of the question I think is really important, and the Minister alluded to that, where this is a shared responsibility. There is absolutely no way that we can have a police officer outside of every house, on every street corner, outside of every shop. We want people to take responsibility for their own actions. We want them to make good decisions and not have to have the police come along and speak to them and issue penalty infringement notices. Quite clearly, what we are seeing is in terms of the smaller shops, also the larger shops, but the smaller shops, the butchers, the grocery shops, those smaller shops in some of these places around Sydney and southwest Sydney. A classic example is the coffee shop, where so many people want to go and get a cup of coffee, me included, but there's a personal responsibility to wear a mask, to make your order, to move back away, to get your coffee and leave. And what we are seeing is that people seem to want to go to particularly these smaller shops and indeed to supermarkets in a pre-arranged fashion and then hang around for hours on end. And what I would ask is that there's a responsibility not just on the person, but the business. And where people are seeing that sort of activity, ring Crime Stoppers. 1800 333 000. 1,000 people a day make reports to police about people who are doing the wrong thing, and we are investigating those reports. The penalties are quite significant. In fact, people can be put before the courts if they continue to offend. So what we need to understand is the responsibility to get us through this very difficult time is that people need to take responsibility for their actions and their decisions every single day.
Would a curfew assist in this compliance operation, particularly in the areas where they're high risk, those high risk LGAs? Would a curfew, if that was imposed, would that be of assistance?
Look, from a compliance point of view, we will work to the public health orders, but really you can put all the rules you want in place, whether it's in southwest Sydney, whether it's going to be in Armidale, whether it was in the central west, whether it's at the beaches. What we need people to do is to understand that they are a part of the solution to what is a very challenging time and a very serious issue that we are all faced with.
Dr. McAnulty, there have now been 5 deaths in patients who've caught the virus at Liverpool Hospital. Would you be able to tell us how many patients total have been infected within that hospital? And also, given that we were told by the district when that cluster started that the nurses involved were all fully or partially vaccinated, what's being done to mitigate the risk of that happening again?
Yeah, so I'll just give an update on the numbers about Liverpool Hospital outbreak. So a total of 4 staff and 29 patients from the geriatric and neurology wards have now contracted COVID-19 after a staff member unknowingly worked while infectious across several shifts at Liverpool Hospital. And sadly, now 5 people have died, and our condolences go out to those families for those people who have died. Liverpool Hospital takes this very seriously, of course. This is, a tragedy to occur, and everyone is working very hard at that facility and across New South Wales Health to protect patients and staff members. So there's a range of measures that are take place when we have cases or exposures to cases in hospitals or other health settings, of which we've had many in this outbreak, and that's a careful review of infection control and making sure that people who have been exposed are given the right information about what they need to do in terms of isolation and further testing.
Dr. McAnulty, how many people in intensive care are linked to that outbreak?
I don't have that information, I'm sorry.
I asked about ICU patients and the Delta variant. I understand that Delta patients spend a lot longer in ICU than other strains of the virus. Is that correct? And what impact does that have on the capacity of the health system to cope?
So Delta, we're learning a lot about Delta strain. It emerged only a few months ago, but it's certainly very severe in terms of its ability to transmit across the globe, including in Australia, and it also seems to be affecting different demographics. Now, how much of that is because of the particular variant or because of the particular communities it's in at the moment? It varies. Those factors such as the community affected, the age makeup of those communities can impact how many people get very sick, because the older you are, the more likely you are to get sick and require intensive care. So there's a range of factors, not just the strain involved, that determines how many people go into intensive care and require additional help. However, what we do know is that in this situation where we have a number of people in intensive care, a proportion of those who are ventilated, and we've seen young people in their 20s, 30s, 40s who are very sick in intensive care and requiring ventilation. So this is a very serious disease. The message to young people is not only that you can get quite sick, but being that often intergenerational link between your parents or grandparents and your children who might go to childcare, you've got a really important part in helping prevent this transmission. So you can drive. We're seeing younger people, younger adults driving the epidemic in many ways by doing essential work, doing the shopping, going home, maybe infecting people at home, or infecting, including older people and children. So the message about vaccination for young adults is really, really important, as well as that message about when you do have to go out because you're an essential worker, make sure that you're following those COVID-safe behaviours. Keep a good distance, wear a mask, follow good hygiene, and importantly, don't go to work if you have any symptoms at all.
Dr. McAnulty, the number of cases in the Penrith area, those 23 cases there, with the mix of those cases, how much concern is there about what's happening there, and is there any concern that Penrith might have to become the 9th LGA?
Yeah, look, we are concerned. We're concerned whenever there are cases, of course, but we're seeing this new front in the Penrith area. It seems the epidemic seems to have marched north and a little west over the last few weeks, and so we're very concerned, and the message to people in that Penrith area is, look, take this really seriously, follow all those COVID health safe advice, but importantly, get tested at the mildest of symptoms to protect your family, and often we're seeing large families in households. Protect your family and protect the rest of your community. Please come forward for testing.
Doctor, given what's happened at Liverpool Hospital, can people whose loved ones are in Liverpool Hospital, or in fact any hospital across the state, feel confident that their loved ones aren't in any danger?
So the health system, and particularly the nurses and doctors on the wards, are of course very concerned when we have cases in a ward, and we have very high level and excellent infection control procedures, very good contact tracing abilities, and we know that our staff are so dedicated and wanting to do the best for their patients. So whenever we get an outbreak, people are really concerned that we make sure we understand how that occurred, learn the lessons from that outbreak, and make sure that we're putting good prevention in place. So the care of our patients is our prime concern, as well as looking after our staff.
Should staff be rapid tested before they're allowed to come to inside the facility each day?
So look, there are a range of measures that have been put in place over the last year and a half since we've had this pandemic, including screening of people before they come to work, awareness about what the best ways to use appropriate PPE and infection control, and we're continuing to strengthen those as we go.
Doctor, just on bookings at state-run clinics, we heard earlier this week there were some glitches with the New South Wales health system. Can you confirm, have they been fixed ahead of trying to get 5,000 people to book at the Olympic Park Hub tomorrow?
I'm just not across that issue, I'm sorry.
That's okay.
Can I just indicate, joys of this job is things happen as you're actually in the press conference. I just received a message from Service New South Wales just saying that people want to make those bookings. It's up on the nsw.gov.au and it is ready to go if you want to make a booking. If you're particularly in that foodie industry, the groceries and so on, supply, delivery, whatever, you can jump on the nsw.gov.au, go to the relevant part and book in. And as I said, there's about 1,000 already booked in, but there's gaps about another 4,000. Thank you, everybody. Can I just say, I want to stress this last little bit that Dr. McAnulty was just talking about. Young people are not invincible. I know when you're young you think you're immortal, but you're not. And to have 4 young people in their 20s in the intensive care unit and 4 in their 30s really does indicate that it can get to you too. But there's not only that, as he was saying, it can affect your family because you can pass it on, but you can also end up with something called long COVID, which the scientists and the doctors aren't even sure about yet as to what it's going to do to you. But it may debilitate you for many, many months. And there was a question earlier about how long people spend in intensive care. I'm very aware that some young people have spent months in intensive care, older people as well. So it's a long while in the hospital, and it may be a long while of debilitation after the disease has eventually seen you out of hospital. I think we all just have to get on board. And as I said, stay home, don't go and visit relatives, don't go and visit another household, and go and get a vaccination as fast as you can. This is our journey and we've all got to be on it together, and we will get there. I promise you we'll get there, but we need you all to be with us. All right, thanks very much to all the media again, and thank you to our Auslan people. Thank you very much. Thank you.